Moving on now, protecting those who are most vulnerable. It was the message at the beginning of this pandemic, and the data shows Kern County has listened. 23 ABC's BRYANNA Willis joining us in the Live Center to explain the actions the county and the Public Health Department took, all to protect our aging community. BRYANNA.
Yeah, Keely, while skilled nursing facilities are primarily regulated by the state, they were hit hard when the pandemic first started. Data here from the Kern County Department of Public Health shows that skilled nursing facilities hospitalized patients at the beginning of the pandemic were at 20%. But after interventions that they put in place, it did not reach over 15%. And now with those interventions in place, it's around 5% for the new average. In an update to the Board of Supervisors today, those who work with the facilities say the system they've built is working, but there's still more to be done.
It is my pleasure to report that compared to the first wave of COVID-19 in Kern County skilled nursing facilities, skilled nursing residents and staff were safer and more protected in all subsequent waves.
Immunocompromised, underlying health conditions, and our older population. These are the groups who are most vulnerable to COVID-19. Many of those individuals reside in skilled nursing facilities or SNFs, which is why the county put an extra emphasis on protecting the homes. The light blue line in this chart shows cases in the general population, and the dark blue line shows cases in the SNFs. You can clearly see the difference.
Early in the pandemic, SNFs were hit hard, with cases rising at a much higher rate than the rest of the community. During the second surge, we saw an increase similar to that of the general population, but with a quicker return to pre-surge levels. During the third surge, SNFs did see a slight rise in cases, but never reached anywhere near the levels of the first surge, while community rates were nearly as high as the first surge.
Jared LEAVITT with Aspire Healthcare Consulting says this is because of the steps the county took with the services.
Reason for the improved outcomes are multifaceted, but include increased availability of personal protective equipment, or PPE, improved training and PPE utilization and infection control standards, improved staffing levels, increased availability of testing resources, a vaccination effort that was very effective, and oversight and accountability from state and county government.
The state also issued more funding last year for the ARMSTRONG program, which works to resolve problems related to healthcare, safety, welfare, and rights of individuals who live in long-term care facilities. But SNF Accountability Officer for Kern County, Georgianna Armstrong, says the program still needs more support from the state.
We do believe that increased funding for the program is critically important. Given the number of programs, the number of constituents, the size of Kern County, the Ombudsman program is running at maximum capacity all the time.
But LEAVITT says it's the swift action that has produced outcomes seen today.
The insight and progressively creative thinking of this board and the Kern County public health officials resulted in aggressive action that protected a very vulnerable population.
And if you want to keep track of skilled nursing facility trends, you can find the full COVID breakdown on the California Department of Public Health website. As you can see here, we already put in Kern County. It even breaks down by county, and you can see all the rates here. And if you scroll down even further, they actually have trends for nursing facilities throughout the state over the last 7 days. If you're interested and want more information, we have this link for you on our website, turnto23.com. In studio, BRYANNA Willis, 23 ABC News, connecting you.